So what do I hate most about respiratory therapy? Well, here it is. Just kidding. My name is Austin Marks and I'm currently a respiratory therapist. I've been in RT for about 2.5, closer to 3 years now. So on my channel I mainly talk about respiratory therapy, however I do have a few other videos discussing a few other things. So I am also the admin of a Facebook group called the RT Club, and on this Facebook group it's full of RT students as well as respiratory therapists where we kind of discuss things going on within the respiratory field, or if students have questions about school they can go ahead and ask that as well. So if you're interested in joining that group, make sure you head over there. Like I said, it's called the RT Club on Facebook. So I do love respiratory therapy. I love the aspect of the job. I love helping people. I just love everything about it except for a few things. So I think the biggest thing that everyone as a respiratory therapist can say that they don't like is the death and dying. So what do I mean by this? Well, we work in the ICU, we work in the ER, we work in trauma, we work within the flight teams, so maybe sometimes we're going on helicopters and we're arriving at scenes where bad things have happened. So a lot of times not everyone makes it. I've seen people who've come in with gunshot wounds, I've seen younger people who have hanged themselves, stabbings. I've seen it all through trauma. However, within the ICU, I've also seen tons of other things as well. So a lot of times what's happening is these people are on ventilators or life support, and we're the ones managing the ventilators or managing the life support, and when they need to come off of that, we're essentially the ones who pull the plug. So we talk to the family's decided, okay, we don't want to go on anymore, this is not what the patient wants, so therefore we go ahead and basically pull out the breathing tube as well as turn off the ventilator. So we don't just do this at random. A lot of times we talk to the families, we have to get consent, because if we just did that, that's a huge no-no and you can definitely go to jail for that. But I think that's honestly the most devastating part is the death and dying, especially when it's a younger person, when it's a kid. I've had babies that came into the hospital who were basically beaten, and you can't really do anything about it. You do everything you can to save the patient, save the baby, but they're already gone. It kind of pisses you off a little bit because the parents are in the very next room and you know exactly what happened, however you can't do anything. I think that's the biggest thing, is the death and dying and all that other stuff. However, that doesn't happen all the time. You don't deal with death on a regular basis, I'd say, maybe a couple times a month. However, there are other days where, like last week, I lost 3 patients in one day. Now that day sucked, but I did everything I could to save them, but it was just their time. I think this comes with any job, but the next thing that I hate the most about respiratory therapy is people call you for the dumbest things. So they think that, oh, respiratory therapy can fix this. So a lot of times I get called for a patient that's breathing a little weird in their sleep, and it's just the way they sleep, the way they snore, the way they whatever, and the nurses think that, oh, some albuterol or a little bit of breathing medicine is going to help them. But no, that's not the case. A lot of other times I have patients who come in who are basically fluid overloaded from CHF or congestive heart failure, and they think, oh, some albuterol, that'll help them. However, they need some Lasix or something to kind of drain out that fluid. And a lot of times they think, oh, well, respiratory is going to come save the day, but really I get there and I'm like, there's nothing I can do, and they kind of just waste my time as well as theirs. I mean, it is better to be safe than sorry for some of these instances, however, it happens way too often, and that is one downfall about respiratory therapy, is people think that you can come and save the day. Now, stating that, there are plenty of times where I do come and save the day because they're like, hey, respiratory, can you come here? And then I go, and the patient is in some kind of respiratory distress or something along those lines, and I know exactly what to do, and then I help the patient out. But I'd say 90% of the times they're just stupid BS calls. And thirdly, I think the thing that I hate the most is I'm dealing with the patient, I'm dealing with the ventilator, the life support, and the family has their degree from Google or Facebook and they think they know everything. So therefore they're saying, oh, why don't we do this? Why don't we do that? Well, we already have, or we can't do that. Or like I had a patient a few weeks ago, and he went into cardiac arrest, and we had to do some CPR, and the family was basically screaming at us that we didn't shock him. Why did we not shock him? They always shock the patient. However, we tried explaining to them over and over again that you can't shock every single rhythm, but this just made them more mad and more angry. This happens a lot with family. They're upset. They have a family member who's in the hospital who's sick. They may not think they're getting the best care, even though you're doing everything you can. And sometimes that just isn't enough, and that's not enough for the family. So the family is not always the easiest to deal with. Some family members are great. They're easy to get along with. I can go ahead and I'm always nice to people. However, you can be the nicest person in the world, and some people are just buttholes to you. This goes for the family members as well as the patients. There are some patients where you're doing everything you can. I'm getting them water, I'm getting them food, I'm doing everything. It's not my job. I'm helping them to the bathroom, whatever. And they're still calling you names. They're saying, "Oh, this is a piece of crap," and whatever. But whatever, I'm there to help out. So that's all part of the job. There are tons of pros, tons of cons. I talk about tons of things I love on this channel. And if you want to see another video where I talk about what I really love about being a respiratory therapist or what I'm compassionate about, I can make one of those. If you enjoyed this video, if you're a respiratory therapist or even a nurse, you work in healthcare, you have some things that bother you, leave in the comments below so other people can kind of see that, get a different perspective on things. Well, anyway, I hope you enjoyed this video, and I'll see you in the next one.